The Early Years Collaborative is a national initiative bringing together Scottish community planning partnerships to make positive changes to the way services work with children and their families. Community planning partnerships are the people who make decisions on local priorities. It includes strategic members of health, police, local authority and the voluntary sector. This short animation aims to give an overview of how this is progressing in Falkirk, to share this information with families and those who work closely with families and children. In 2008, Scottish Government published a paper called the Early Years Framework. They set out their aspirations to give Scottish children the best start in life and the steps they would take to reach this aspiration. The Early Years Collaborative highlights the importance of early intervention within early years, investment and support to ensure better outcomes for all. Since 2013, local professionals who either make decisions about services or work directly with children and families have gone along to a number of learning sessions. They have learned from research how vital changes can be made to help improve lives for our children. The model for improvement is a scientific process to enable practitioners to make small changes and measure the impact on children and families. The basics are: you have an idea about how to improve the way you work with a child or family. You make a small change that embraces that improvement, and then you study the results. Did it make the difference you wanted? The results are then reported. The important factors are reporting whether improvement has been achieved and learn from these tests. Those who work with children and families are aware it is important to identify what doesn't work as much as what has been successful. These small changes are then shared with others around Scotland so there is a national picture of which changes can lead to improvement. After the learning sessions, the group come back and share what they have learned with other people in their work. At present, we have a number of people who are working with children and families, testing out their work practices to see if it improves the work they do for that child or family. The findings of these tests are collated centrally in Falkirk so we can share and learn from them. The group also share their learning from the learning sessions and the testing that has been going on to a wider group of people who work with children and families at an event called Falkirk Early Years Collaborative Home Team. The more people who know about what is being learned, the more likely we are to improve our work with children and families. One of the national aims is to reduce infant mortality. Research tells us that the health risk to a pregnant mother and her baby is greatly reduced if they are attending the maternity appointments and being monitored by the very early stages of pregnancy. In Falkirk, midwives have been testing different methods of increasing pregnant mothers' awareness of how to book their first appointment with the maternity services. Being aware of how to book into these appointments reduces any delay in getting the appropriate support. In Falkirk, they have developed posters about the booking system, put information cards in pharmacies next to pregnancy testing kits. This has resulted in pregnant mothers booking directly and earlier. Another aim is that children will be meeting their expected developmental milestones by the time they have their 27 to 30-month assessment. This has been introduced across Scotland, and in Falkirk, health visitors are working towards carrying out these reviews for 100% of the children in their practice. One of the tests that is simple and has proved a huge success is changing the way the appointment is made. The health visitor phones the parent to make the appointment at a mutually convenient time, instead of the previous practice of sending out an appointment, not knowing if the parent was able to attend at that time of day. This personal contact has led to this health visitor having all her families attending the appointments and 100% of the reviews completed. Another aim is that children will be meeting their expected developmental skills and abilities when they start primary school. Nationally, every parent is given a book called Every Day's a Learning Day. It is given out by the health visitor with the book bug package. The book is a great aid to doing everyday activities with your child to help them develop and learn. However, we realise that parents often find it difficult to allocate time to read this material. In Falkirk, we have produced a short animation that explains the basics of this book and are testing whether it is a more productive way of getting the message across to parents. If you work with children and families in Falkirk, look out for the dates of those wider home team meetings or call the Falkirk Early Years Collaborative team to be added to the list of people who wish to be involved. If you are a parent, you ask your health visitor or early years officer at nursery if they know about the Early Years Collaborative. Are they doing any small tests you could be involved in? Or perhaps you could share ideas with them about what would improve things for you and your child. You can visit the blog at the following link, and you can also view Every Day's a Learning Day animations at the link detailed here.